My mom was from the East Coast. She was born in Hartford, Connecticut. She was her town's version of Shirley Temple. She used to tap dance and was fairly popular. She was in newspapers. Loved to travel, so we used to do that together. And she just had a youthful spirit. My mom was in the early stages of Alzheimer's, and she was diagnosed with stage 4 non-Hodgkin's lymphoma. So we kind of did some initial treatment, and when that proved to be not successful in the long run, we basically opted for quality of life over quantity of life and went into hospice.
Hospice is a service intended to provide care for patients in the last 6 months of their lives. People are often confused and scared, and one of the biggest things I think we do is help everybody to talk to each other. Hospice is really very focused on hope.
The situation for me was a stressful one. I'd lost my father years before, but my mother, back then my mother was the primary caregiver, so this time around it kind of fell to me to do that. It was a very high stress period because you're making life decisions. You know, signing a DNR is a big deal. So, you know, it's nothing I had experience with. It was traumatic.
When hospice comes in, it can generally be a huge relief to people. So let's help you get this organized. Let's find out what you want and how we're going to be able to put a package of services together.
We had folks come to the house, kind of explain the program to us. We had a regular nurse, we had on-call nurses, chaplain services if we needed it. We were told that we had a social worker, you know, at our disposal. We also decided that my mom would need 24-hour care when I wasn't around, and so hospice was very good at putting us in touch with folks that could help us with that. It felt like we just had a network of support.
When things are able to go well at home for the survivors, they oftentimes feel so much better about the experience. It feels like they've done a good job, had some control over the situation, and so afterwards it allows them to cope much better.
After my mother passed away, you know, I went to bereavement classes, and so they kind of followed me for the first year afterwards. Sutter they would send me literature telling me what I could expect at that period of time, or if a holiday was coming up, you know, how to kind of get through that. And I actually used that literature, you know, and helped other friends. And then within probably the first year of my mother passing, the hospice program did a remembrance ceremony where they kind of got us all together, everybody who'd lost somebody, and we kind of celebrated them, and it was wonderful. You know, I know that philanthropy plays a big part in what hospice is able to do, so I can't imagine them being able to provide the services that they do without it. You know, I think it's an integral part.
When I think about hospice, it kind of is the epitome of We Plus You. Providing care in the patient's home, building a link between the patient, the family, the physician, the hospital.
Where you kind of realize what an important event that was and how important it is to have, you know, people to help you kind of through your journey. They're, you know, the angels here on earth. I honestly don't know how they're able to do that day in and day out with such dedication. You know, they're very caring individuals, and I just think they're one of a kind.